My name is Abigail Moore, and this is my persuasive speech. Munchausen by proxy. Who plays the sick? Child abuse isn't something that we're unfamiliar with this society. You know the signs and you know the symptoms to look for. But Munchausen by proxy abuse goes below detection. Hulu recently released a new show titled The Act, where the abuser blends into society. And for added dramatic effect, they also go into the crimes that occurred due to this abuse. Munchausen by proxy is a dangerous mental disease that causes a unique form of child abuse to occur. I'm fascinated with psychology, and therefore this was an interesting topic to look at and research. We're going to look at the problems and the causes, such as the psychology behind this issue, and ultimately a solution. In The Act, Gypsy Rose is a child who undergoes several medical procedures due to her illnesses. Her mother takes care of her, and in the end, you find out actually she's not sick with any of them. Even the cancer was a lie. So, what causes this? Munchausen by proxy deliberately fabricates, exaggerates, or induces health problems. According to Ozadimer, the writer of a Turkish case study on Munchausen by proxy. In Gypsy Rose's situation, her survival rate was insanely high. She was 23 at the time of her mother's death. And in most situations, children die because of all of the medical procedures that they undergo. The median age, according to Ozadimer's study, was around 9 months when the symptoms started to occur, according to the caregiver. Sleep apnea was one of the main symptoms that occurred. There were other situations where hypoglycemia occurred, nasal, auditory, and oral bleeding, an inability to walk, and in one extreme situation, supposed sexual abuse. Some of the familial characteristics are interesting to observe as well. Most of the caregivers came from low socioeconomic backgrounds. The mothers came from extended families with low social support, and the fathers were passive with no knowledge of illness from the caretaker. They had no idea of the mental things that were going on or the abuses with their children, and were therefore emotionally and physically passive in these situations. What causes this? From the caregiver's perspective, there's an inner need for their child to be ill or injured, and therefore undergo procedures to fix this problem for attention and sympathy. This disorder stems from severe emotional difficulties. According to the Cleveland Clinical's website, all of this is true. Symptoms to look for within the child of this particular caretaker would be hospitalization with strange symptoms, worsening symptoms seen by the mother and not by other hospitals or physicians. Conditions don't agree with the test. Unusual deaths can occur in the family's history, the direct family, such as other siblings. Unusual blood labs coming back and not matching the child's blood type at all. Chemicals can be found in blood and urine samples, and the child's health will improve at a hospital but not at home, according to the caregiver. In the parent or the caregiver, symptoms you can look for are interesting enough. It's usually the mother that this occurs in, but it can be anyone. There are situations where the caretaker is taking care of an elderly patient. Can be a healthcare professional, very cooperative with doctors, overly concerned with the patient's health, and can have factitious disorder of oneself, such as Munchausen syndrome, believing that they have symptoms for sympathy within themselves. These are both from the Cleveland Clinical's website. As a solution, medical ethics comes into question. Unresolved, with no guidelines, how is a doctor supposed to approach this issue? A physician's experience ultimately comes into question. Some will choose to focus on this and look into the medical records, and others will choose to ignore it. Difficulty to diagnose the patient's comes with honesty from the caregiver and unclear symptoms, it's very difficult to diagnose. Medical records, again, are very important to be observed and looked through, and it's so important to be aware and alert of these kind of issues. Discern truth from fiction and follow your gut. When it comes to the abuse, you have to know how to look for the signs. There's no way to tell how big of an issue this actually is due to the abuser just being below the radar all the time. If you find out that something suspicious is going on, you need to get help. According to the Romanian Journal of Pediatrics, excuse me. This is a horrifying reality, but you have to remember how to solve and react to these kind of issues. Once again, we looked at the problem of Munchausen by proxy. It's a silent issue. We looked at the cause, the psychology behind it, and the symptoms that follow, and a solution, the signs, and pursuing help. Munchausen by proxy is a dangerous mental disease that causes a unique form of child abuse. You have to be aware of your surroundings because you never know what could be happening right under your nose. Thank you.